All right, welcome back to ARC Salt Lake. We cover authentic, relevant, and community stories. Being prepared for emergencies, that's what we're going to talk about. It is vital, especially if one involves a medical decision. Not everyone is prepared when a critical choice needs to be made on behalf of someone else.
Well, we have Dr. Dominic Moore here to talk a little bit about why it's important to be prepared, especially for a medical emergency if the injured person can't speak for themselves. We're talking about advanced directives. They've been around for a while, but people still need to know more about them.
Yeah, absolutely. We really see them as a way for a person's voice to continue to advocate for themselves, and also for a way for families to know how to best take care of the people that they love.
Let's talk about what an advance directive is, first of all. For those who don't know, maybe they're hearing this term for the first time.
Yes, so an advance directive is a way for a person to designate in a document who should speak on their behalf if they're not able to speak for themselves.
And it's a legal document.
It is a
You
legal
don't have to have an
document.
attorney for it, though.
Yeah, absolutely. So it's a legal document. It's signed and witnessed. It's something that we can take care of in hospitals. It can be taken care of in your doctor's office. And really, these forms are online and available widely.
When should people be considering this? Is this for younger people, older people, everybody in between?
Great question, yeah. So we recommend that anyone over 18 thinks about who might speak for them if they aren't able to speak for themselves. And really some of the children that we take care of as well up at Primary Children's have medical issues where an advance directive and thinking ahead about some of these things that might happen is really valuable.
Well, you could get in an accident and not be able to speak for yourself.
Absolutely.
And family might not know unless it's on a form that they
Absolutely.
can. How does a doctor call that up and know what to do?
We do our very best to keep track of those in our electronic medical record.
Okay.
We do our very best to get that shared, but often, unfortunately, people have an advance directive, but it's not in our system, and so we work with their family or whoever might know. And doing this, we realize often people haven't communicated to anyone about their advance directive, unfortunately.
I know people could imagine some scenarios out there, but can you just give us a few examples, some scenarios when something like this might be called upon or used?
Absolutely. So I think about a case that we had in the past where a matriarch of a family here in Utah came into the emergency department. She was quite old, had a lot of people there who really cared about her and had different ideas about how she wanted to be cared for. And luckily, she had had the forethought to put together an advance directive, and so people didn't have to guess. And this big family who loved her and were really trying to do their best for her were able to sit down and say, oh, we're doing what mom or what grandma wants us to do. And she was able to get the care that she wanted during a really sensitive and hard time.
And no fighting over
over
what's going to happen because she had it down on paper.
Absolutely. So this is a really great way both to take care of yourself, make sure your voice is heard, and also to take care of your family. Like you mentioned, no fighting.
Yeah. How do you go about starting to sign up, or how do you find it?
So the advance directive is online, and I believe that that link will be provided. But also, it can be a simple conversation with your doctor or a nurse or a healthcare provider. If you have any questions, Intermountain this coming week has a workshop that's available for people who might not know about advance directives or might just have questions.
Does this get into specific medical situations, or is it general, or is it different for every person, basically?
Yeah, it's great. It's different for every person. So some people have it as general as to say, this is the person who will speak for me, and please talk to them. Some people very specifically will say, this is important to me, or this is important that you don't do this to me, and that can be in an advance directive. There's also a form that's a little bit more of an official order. It's called a Provider Order for Life-Sustaining Treatment, or POLST. And that's something that you would sit down with your doctor or nurse practitioner or PA, and it really is an order that you or your family would present to emergency response teams to say, this is how you take care of this person, and it's very specific.
Because there are different levels of life-saving care that perhaps one person would choose that another person wouldn't.
Absolutely, yeah. Having done this for quite a while, I don't guess anymore about what people might want. Every person,
as an emergency doctor, you can look it up immediately and know what you need to do.
Yeah, so our emergency departments have this in their electronic medical record, and it's very, very helpful to know what's going on. Now, the caveat I'll say is they have it as long as it's been provided to the medical system.
Right. So you have to fill out the form. And what about personal security? Does any of your personal information get out if you fill out this advance directive?
It shouldn't. It's treated like private health information, and so we're very careful with that, for sure.
You've obviously been explaining this, but people could still hear this term, and a lot of people still think will. So just talk about the differences between will and an advance directive. Absolutely,
yeah. And very commonly, putting together an advance directive is something that your attorney might bring up when you're putting together a will. A will has to do with how people take care of your property and those sorts of things. And I'm not an attorney, so I won't get into that. But this is really very focused on health decisions and the way that you're treated in a healthcare setting. It does not require an attorney, and it's a document that you can really take anywhere and really has application in many more situations than just the very end of your life.
Okay. And you talk about it being online. If you fill this form out online and somebody witnesses to sign it, and then it gets sent immediately to the medical facilities.
Yeah.
Okay.
Yes. Yeah. So it gets sent to your medical facility that you share your information with, because it's private health information. Right. It's kept within that system, and you have the right, because it's your information and your document, to share it with any health system that takes care of you.
Dr. Dominic Moore, thank you so much for talking about this with us. It's an important topic.
Thanks so much for having me.
Yeah, that workshop coming up on
April 29th.
29th.
At 10 o'clock.
Okay.
Yeah.
Very cool.